Welcome back to America's Healthcare Challenge. Hope you're having a great day. This is another part of our ongoing series talking about the biggest surprises in healthcare over the last decade.
Please hang up and try again.
Once again, here's your host, Sean McGuire.
When we got this daily harvest, do you ever get that stuff? Those meal kits? It's a balmy 1 degree today. 3 o'clock. Only reason I'm going out here is the app says it feels like it's negative 19. Because I thought I had to check. No. The incentive didn't work out. Kind of like how it is in healthcare. When you look at when they were designing health reform, they kind of had to try and create a win-win. And they did for some people, but they didn't for others. Like us, consumers of healthcare, small businesses. The lobbying power of the industry really has shaped where things are right now. And so this segment, we're going to talk about some of the, I guess you could say, challenges that we need to face and why it's going to result in some people having to become a little bit uncomfortable in order for us to be able to make our healthcare system, get up to the level as some of these other industrialized nations. But when you look at the major players in all of this, they don't really have an incentive to change. It's really important to understand how insurance works. And one of the biggest things in the Affordable Care Act was how do we get coverage for all of those. There was about 46 million people that didn't have insurance at the time. How do we get them coverage? If you remember, the law was incredibly political. It's very, very sad how political things have gotten, especially when it comes to healthcare. But the insurance lobby, the pharmaceutical lobby, the hospital lobby, all of them really came to the table at the White House and said, well, we won't really kill this legislation if we can get certain stipulations. They essentially picked the taxes that they would have to pay, and they've adjusted accordingly, much to the chagrin of healthcare consumers. What do I mean by that? When you look at the average cost of deductibles since the passage of the ACA, so that would be deductibles for people with individual health policies, if they work for a small business or a large company. Most people's deductibles have gone up since the passage of the ACA. Now, in the last episode, we talked about the incentives for hospitals and how they had to invest huge amounts of capital into things like electronic medical records. Now, they're on one side. They're raising prices. We've already talked about that and we discussed that. You, the consumer, with a higher deductible are now on the hook for larger out-of-pocket costs. And healthcare costs have actually become one of the largest causes of bankruptcies in general. So hospitals are raising their prices. Patients have deductibles that are going up, leaving them on the hook for more exposure. And you have insurance companies whose profits are now tied into a thing called the medical loss ratio. And what that means is that the ACA mandated that insurance companies have to pay out a certain amount of money in claims. And so this is the first time, essentially, in American history that the federal government told an entire industry how much money it could make. But they limited it. And they said it was an 80-20 rule. So 80% of the money that comes in has to go out towards claims. Hospitals are raising their prices. Insurance companies are paying the claims for the patients that are going in there. They're limited on how much money they can actually make. So the only way that they can really react and continue to be profitable for their shareholders is to raise premiums. So we've got premiums raised on one hand by the insurance companies. We've got prices raised on the other hand by the hospitals. And then that doesn't even get into the issue with the pharmaceutical industry, which has gotten even more and more outrageous. And so we as taxpayers and citizens and those that are access to the healthcare system are really kind of stuck in a difficult spot. Unfortunately, our leaders in Congress are avoiding all of this because these are some areas that actually both sides can agree on. The Trump administration and congressional Democrats both have been on record talking about how problematic the pharmaceutical industry is, for example. When you look at the profits of these industries over time since the ACA, they've gone up at astronomical amounts, nearly 10 times for certain insurance companies. So in order for us to really solve this problem, we all got to get educated about what's really going on, and we need to demand that our leaders in Congress change the incentives in the healthcare industry.